Question 1. A 37-year-old man presents with a slowly enlarging, firm mass on his jaw that has developed over several weeks following a dental extraction. On examination, the lesion is tender and draining purulent material. Microscopic analysis of the drainage reveals yellow granules composed of bacterial filaments. Which of the following organisms is the most likely cause of this infection? A. Actinomyces israelii, B. Nocardia asteroides, C. Staphylococcus aureus, D. Pseudomonas aeruginosa, E. Mycobacterium tuberculosis. Correct answer, A. Actinomyces israelii. Explanation. Actinomyces israelii is an anaerobic gram-positive filamentous bacterium that is part of the normal oral flora. It is associated with cervicofacial actinomycosis, especially after dental procedures or trauma. The presence of yellow, sulfur granules, actually clumps of bacteria, is characteristic. Why not the others? B. Nocardia asteroides, filamentous and partially acid-fast, but causes pulmonary or CNS infections in immunocompromised patients. It does not produce sulfur granules. C. Staphylococcus aureus, common cause of skin abscesses, but does not produce filamentous structures or sulfur granules. D. Pseudomonas aeruginosa produces a blue-green pigment, pyocyanin, not yellow granules, and more associated with burns or otitis externa. E. Mycobacterium tuberculosis causes caseating granulomas and pulmonary symptoms, not yellow granules. A patient presents with a draining facial lesion containing granules composed of tangled bacterial filaments. Which feature best distinguishes the responsible organism from other filamentous bacteria? A. Aerobic metabolism and partial acid fastness. B. Blue-green pigment production. C. Branching anaerobic gram-positive rods. D. Mycolic acid in the cell wall. E. Motile gram-negative rods. Branching anaerobic gram-positive rods. Explanation. Actinomyces israelii is identified by its branching filamentous morphology, anaerobic growth, and gram-positive staining. It is not acid-fast, distinguishing it from Nocardia. Why not the others? A. Aerobic metabolism and partial acid fastness describes Nocardia, not Actinomyces. B. Blue-green pigment production, characteristic of Pseudomonas aeruginosa. D. Mycolic acid in the cell wall, seen in Mycobacterium and Nocardia, not in Actinomyces. E. Motile gram-negative rods describes many enteric pathogens, not Actinomyces. Would you like